My name is Dr. Benjamin Schindel. I'm here from the Kennedy Krieger Institute, and I'm here to talk about my project, Age of Autism Spectrum Disorder in a Nationally Representative Sample. Now, we know how common autism is. The average age of diagnosis ranges from about 4 to 7 years old in the United States, and there are lots of factors that are associated with delays in diagnosis age. One of the factors that receives sort of less attention in the literature is just how difficult autism is to diagnose in older children and adolescents. And one of the reasons that I'd like to highlight here is the dearth of screening tools that we have for use in later childhood and adolescence. The screening tools here are illustrated here. These are the AAP recommendations, end at 24 months. So what I wanted to do was describe the patterns in the age of autism diagnosis. And I suspected that we would see more diagnoses in early childhood compared with adolescence, and that there would be some significant influences of those known sociodemographic factors. So I used the National Survey of Children's Health, which is an annual household survey. A parent or caregiver will answer the survey on behalf of one of the children living in their home. This is run by the U.S. Census Bureau. So in our sample, we restricted to children and adolescents 3 to 17 years old. We looked at the age at which autism was diagnosed, and we looked at some of the sociodemographic factors in the source of the diagnosis. One point that I want to make is in the data sets that are available for download from the internet, the age of autism diagnosis was a value 1, 2, 3, 4 years, et cetera, up to 14, and then grouped for anybody who is diagnosed at 15 years or older. So that would limit our ability to look sort of in detail at that group. But what I wound up doing was looking at the sample subset that had been diagnosed at 15 to 17, or that were 15 to 17 years old when the survey was completed, and looked at their answers retrospectively. So in the end, we had over 100,000 individuals. About 3% of the sample had diagnoses of autism, which was consistent with national prevalence estimates. And in the whole sample, the median age of diagnosis was 5 years. This graph is showing the age at which the survey was completed along the x-axis compared with the age at which autism was diagnosed. And the main takeaway from this is just how flat that line is. What this is telling us is that for pretty much every age at which the survey was completed, or at which the child was when the survey was completed, autism had been diagnosed at somewhere between 4 and 6 years old. When we look at the proportion of ages of autism diagnosis, we see that the peaks are at 2, 3, 5, 6 years, and then really tail off after 6 years. We also found that far more children were diagnosed in early childhood, 0 to 5 years, compared with adolescents. And when we compare those prevalences, it was about 0.38, so it was substantially more children in early childhood. We also saw that some demographics were disproportionately represented, but other factors were associated with greater diagnosis later in adolescence or later in childhood. So male sex was overrepresented, but female sex tended to be diagnosed later on. Non-Hispanic white racial and ethnic identities were overrepresented, but Hispanic and non-Hispanic multiple racial and ethnic identities were more likely to be diagnosed later on. And you can see some of these other results here as well. We found that non-school psychologists and psychiatrists were more likely to diagnose autism in adolescents compared with early childhood, and were also just generally more likely to diagnose autism when compared with primary pediatricians. So we know that there are lots of sociodemographic factors that influence the age at which autism is diagnosed. And I think that some of these could point to potential opportunities to improve access to diagnosis and to care. But also, I think that these findings might be suggesting that there are some misdiagnoses of autism in later childhood and adolescence when we don't have screening tools and the symptoms change. These are findings that I think can help to support the argument that we need greater identification practices for older children and adolescents. And this can occur through educational outreach, through developing screening tools, training primary care providers, or training teachers and families and individuals themselves. But I suspect that there will be a number of challenges with this, including the structural problems that are inherent in these gross health inequities, as well as barriers put up by things like schools and IEP teams that might not consider symptoms academically impairing, even though they would still qualify for diagnosis. So thank you very much for your attention. This is my contact information. I would love to continue this conversation with anybody who's interested. And here are my references.